Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Federal government approves list of activities to mark Nigeria's 60th independence anniversary, announces low-key celebrations due to the outbreak of COVID-19. Yobe State's Independent Electoral Commission reschedules local government elections to February 27, 2021, after recording more cases of COVID-19. And about 2,500 students at a Swiss hospitality school placed in quarantine after a major outbreak of the virus following private parties. Let's begin in Africa, where confirmed cases are at over 1.4 million, with more than 1.1 million recoveries. The Africa Centers for Disease Control and Prevention says the region is recovering at 82%, and this has been stable for the past couple of months. However, 5 countries represent 70% of the continent's total caseloads. South Africa is first with about 47%, followed by Egypt, 7%, Morocco as well with over 100,000 cases. You have Ethiopia recording 5% of the cases and Nigeria 4%. According to the Africa Center for Disease Control, 5 countries are reporting highest number of new cases between September 17th to the 23rd, and they are Morocco, South Africa, Libya, Tunisia, and Ethiopia. The trends for the Africa region in the last 1 month shows different ranges by region. Central Africa, which reports its numbers in batches, saw a 56% increase, followed by North Africa 14%. However, a decrease in the number of coronavirus cases was maintained in East Africa at 15%, Southern Africa 11%, and West Africa at 14%. Now, the center says the message behind the figures is that the public health measures, the triage and community engagement are working. In the meantime, the Nigeria Center for Disease Control reported 111 new cases last night, bringing the total case number to 57,724. These new cases were reported in 11 states, plus the Federal Capital Territory. The NCDC report shows that 48,985 recovered patients have been discharged, and the death toll at 1,102. Now, outside the shores of the African continent, Europe has recorded over 5 million coronavirus infections since the first case appeared in China. Reports say that more than 380,000 new cases have been reported in the past week, the highest number in the region since the start of the pandemic. It shows that more than half of the cases are in Russia, Spain, France, and the United Kingdom. Experts say the rise in infections can be partly explained by the sharp increase in testing in countries including France, where more than 1 million tests are now carried out every week. The federal government has again indicated that the nation's 60th independence anniversary celebration will be low-key because of the coronavirus pandemic, even though the government has lined up a series of activities to mark the Independence Day between now and September next year. At a news conference in Abuja, the Minister of Information and Culture, Mr. Lai Mohammed, notes that the federal government has approved lists of activities staggered till the end of September 2021 to commemorate Nigeria's Diamond Jubilee anniversary. He also faults the argument that there is no reason to celebrate at 60, considering the numerous challenges facing the country, insisting that the answer to that argument is contained in the theme for the celebration.
The 60th Independence Anniversary celebration will be low-key, as our President has already announced. Of course, this is not unconnected with the COVID-19 global pandemic, which has forced some safety protocols on nations around the world. Let me say here that the 60th anniversary celebration will be celebrated for a whole 1 year, ending September 30th, 2021. This, however, does not mean there will be daily activities between now and September 30th, 2021, or that there will be staggered events during the period. Now, some may wonder why Nigeria needs to celebrate its Diamond Jubilee at all. considering the myriad of socio-economic challenges facing the country? And our answer to that is contained in our seal of together. For a country that has gone through a bitter intercessory civil war, years of political crisis, daunting social challenges, including religious and ethnic crises, etc., our unity and our resilience, which, by the way, is what Diamond represents, are worth celebrating.
Meanwhile, 3 smart walk-through sample collection booths from the government of the Republic of Korea has been donated to Nigeria to help boost COVID-19 sample collection and testing, as well as reduce infection among health workers. Speaking at the handover ceremony at the Nigeria Center for Disease Control, NCDC referenced laboratory in Abuja, the Director General of the agency says the donated items will support government's efforts to ramp up testing for the virus. Yobe State Independent Electoral Commission has rescheduled its earlier December 5, 2020 local government elections to February 27, 2021, after recording 2 cases of COVID-19. The executive chairman of the commission, Dr. Maman Mohammed, disclosed this in Damaturu, the state capital, while briefing journalists. He explains that the change becomes necessary after receiving the NCDC election guidelines and INEC's policy document during the pandemic. The state chairman of the Party Advisory Committee says an immediate meeting with all leaders of political parties in the state will hold to discuss the matter.
After due consultation with our critical stakeholders, we find it necessary to readjust the date of our proposed elections to prevent the spread and the escalation of the incidence of the virus manifestation in Yobe State. Our local government council election, earlier scheduled for 5th December 2020, is hereby shifted to hold on 27th of February 2021. A new schedule of election activities is being reviewed and will be released very soon.
The Adamawa State Government has announced Monday, October 12, 2020 as date for the reopening of both public and private schools from the basic to tertiary levels across the state. According to the press secretary to the government deeply regrets the long closure of schools as a result of the coronavirus pandemic alongside other sectors of the economy. Governor Maruf Interior also expressed that his government will not leave any stone unturned towards ensuring the enforcement of the COVID-19 protocols. Meanwhile, Adamawa State is set to establish sample collection centers in all the 21 local government areas of the state. According to the NCDC technical advisor, the state has not been testing for about 2 weeks now, which might not be unconnected to the low record of new cases in the state.
Our mandate is to support states in this response. We want states to take responsibility in this response. So we intend to decentralize sample collection centers in all the 21 local governments. These sample collection centers will be located in strategic areas in these local governments. The risk communication peer will also sensitize the community in the need to test. When we start this testing, our target is to test at least 500 samples in a day in Adamawa State. In long run, we want to achieve at least 1% of the population being tested, which is about 35 to 40,000. So at the end of this intervention, NCDC will now tell Nigerians the true story of our status. But we can't really see if we are flattening or declining now because our testing rate has declined by about 36%, and also our positivity rate too has declined by about 16%.
SORMAS is a digital surveillance tool which facilitates real-time reporting of cases of epidemic-prone diseases, including COVID-19, by health workers across states. To tell us how this helps the battle against community transmission, we have joining us from our Abuja studio, Dr. John Oladejo. He's the Director of Health Emergency Preparedness and Response Department at the NCDC. Thank you for joining us on the program.
Thank you.
So SORMAS means Surveillance, Outbreak Response Management and Analysis System. How does it work, especially in the COVID-19 fight?
SORMAS, as you rightly said, is an open source of a mobile health system that actually processes disease outbreak as well as management of the cases that are actually coming in, through digitalized surveillance system, both at the facility as well as the laboratory. So how it works is that we were able to actually deploy this software to all the borders as well as all the state of the federation. So this is a real-time collection of data. So as the case is occurring and is being entered into this software, we are actually receiving it from our office, and all the pillars have the opportunities to actually view it too, and then take necessary decisions. So this is exactly what we did. As the as the cases are actually being imported into the country, we are seeing it, and then we are taking prompt response to ensure that we contain it. So this is how it works. The software works all over the country.
Okay, I was going to ask how indeed it helps with ramping up testing, scaling up testing, because I know that SORMAS was also used during the peak of Lassa fever and monkeypox in 2018, but then it was just in a few states.
Yes, during this COVID-19, we were able to deploy SORMAS to all the states of the federation now. We have our health workers, our data manager, as well as our surveillance officers in all the states of the federation. And then we have equally trained health workers at the state and the local government level. So we have it in strategic places where the data have been entered as it occurs. So this has actually helped us to really follow up cases with the case management modules. We follow up the contact with contact module, and we equally follow up the results to link with the software in all over the countries where we have this software. And this software is hosted in our office in Abuja, Nigeria Center for Disease Control, and is linked to all the public health emergency operation centers throughout the federation. So each state has its own password, and they can view what is happening in their state. They will be able to take necessary measures to ensure that they actually contain the disease. So this is how we are able to really get all the cases, all the contacts, and all the results that we are getting from the laboratory to be processed, and then link up with all the pillars, and they will be able to take opportunity to act immediately.
Just quickly, before you go, Nigeria is still far from its goal of 2 million tests. What has been done to reduce turnaround testing time and conduct more frequent tests on the population?
So the first thing we did was to increase the number of molecular laboratories all over the country. And then we now deploy SORMAS to each of these laboratories with health workers, data managers that are actually working with them. So with this, we'll be able to really follow up each case as it occurs, and then link it to the result, and then ensuring that all the necessary pillars take necessary step on it. So with the number of molecular laboratory, we are equally scaling up testing in all the local government of the federation, as rightly said during the interview with one of our colleagues in Adamawa State, because there have been a decline in the number of tests, but efforts are on top gear now to ensure that we increase the testing capacity by ensuring that we increase the sensitization at local government and even at the community level. So within a very short period of time, the number of tests that will be conducted in each of the local government will increase, and this one will show that we need to have at least 1% of the total population, which is 2 million. So by the time we reach that level, we'll be able to know, yes, the status of COVID-19 and know whether we are actually flattening the curve or not.
All right. Well, I appreciate your time. Thank you so much, Dr. John Oladejo, Director of Health, Emergency Preparedness and Response Department at the NCDC. Thank you for joining us on the program.
Thank you for having me.
We have more on the global response to COVID-19 when we return. Please stay with us.
The following measures are crucial in the fight against COVID-19. Maintain 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Do not touch your nose, mouth or eyes. Remember, avoid physical contact with people. Simply greet with a wave, a nod or a bow.
In an effort to boost healthcare as the world fights the coronavirus pandemic, the Borno State government is proposing a budget of at least 1 billion naira for free maternal drugs to women in the state. Governor Babagana Zulu made the remarks at an event marking the flag-off of distribution of drugs and medical consumables. He said it is becoming increasingly difficult for women to get access to drugs, which is responsible for maternal mortality rates in the state. According to him, access to qualitative healthcare is an important project for his administration, assuring that for sustainability to be achieved, the initiative will be captured in the next budget and subsequent.
We also ensure that this scheme is being captured in our 2021 budget. This is very important. A budgetary provision of nothing less than 1 billion naira has to be met. This is something that I want to see in my lifetime as the governor of Borno State. You are also very aware that last week or last 2 weeks ago, Government of Borno State has approved for the recruitment of 359 nurses and midwives, 100 other health workers, and about 80 doctors, totaling a number of over 500 health personnel that has to be distributed to our various health institutions in the state. Again, I'm calling upon the Hospital Management Board to ensure equitable distribution of these health personnel in the state, devoid of any irregularities.
Meanwhile, more Nigerians are calling for effective community engagement at grassroots levels to limit the spread of the coronavirus. Earlier today, in a chat with a public health physician, he says that although there are efforts by the NCDC and the federal government in ensuring awareness, the engagement of community stakeholders as well as scaling up testing in communities remains an effective way to tackle the virus.
Look at the approach that Africa is basically, which is about the community engagement. It's very, very important because if you do not engage the community, whatever method or methodology you want to use is not going to be effective. You want to also involve the stakeholders, the religious leaders, the grassroots leaders. Those, of course, that approach, if you don't appropriately involve them, then it's as well as good that your method will not be effective. So far, so good. If I'm to rate, I would say we've not done badly. We've not done badly. We've had situations where we've ramped up testing. Albeit, there's still, like I always say, there's still room for improvement. The federal government, of course, and the NCDC have actually done enough, but there's still much to be done. Because a lot of people at this point are becoming fatigued. A lot of people also think that COVID-19 has ended. If you go around, you find that people really do not use their face masks. So I would advise the federal government and NCDC to continue to push the message that COVID is still very much around. People are still dying. The numbers are still there, although the number is increasing. So they need to do more of orientation. They need to do more of advocacy. They need to also continue to engage the community stakeholders and people that are involved.
Now, since COVID-19 took the world by storm, corporate entities, business owners and individuals have been counting their losses. The president of the Pharmaceutical Society of Nigeria, Mr. Sam Ohuabunwa, says the losses in his sector since the outbreak of the pandemic is over 5 billion naira, and that although things are gradually opening up, recovery is slow.
China was closed, India was closed, then traffic, logistics, air transportation. As I speak to you, it's not resolved yet because some people are starting and going back, closing and locking and locking up and locking off. So there's lack. There are supply gaps there in the market, and that's because there were these disruptions. So companies couldn't produce. They didn't have raw materials because of the lockdown and the issue of no traffic. Logistics. And some countries decided they weren't going to even allow you import anything. India put out a list that they will not sell their APIs because what we import is mostly pharmaceutical active ingredients for manufacturing. They say they won't import. So and now I'm sure they're just getting back to it until they restore their own domestic supply. So we lost a minimum, I've done their calculation, a minimum of 5 billion in lost sales opportunity.
Some 2,500 students of a prestigious Swiss hospitality school have been placed in quarantine after a major outbreak of coronavirus following private parties there. This is according to regional authorities. Around 75% of the total number of students at the school in Lausanne have been asked to stay at home or not leave their on-campus accommodation until September 28. Authorities say that a number of outbreaks have been reported within different departments, making it impossible to introduce a more targeted lockdown than the 2,500 students who are involved. Here's more on the global update.
EU health officials say Europe is at a decisive moment, with countries on the brink of national lockdowns. Officials say a surge in COVID-19 cases risk becoming a deadly double epidemic as the flu season approaches.
We cannot lower our guard. This crisis is not behind us. Moreover, autumn and winter are the time of the year for more respiratory illnesses, including seasonal influenza. To prevent what could potentially be a lethal twindemic of COVID-19 and the flu, which could overburden our health systems and lead to more loss of life, we need to increase the coverage of vaccination rates.
In France, the health ministry reports on Thursday that number of people in intensive care due to coronavirus has jumped over 1,000 for the first time since June the 8th. Meanwhile, already heavily hit by France's COVID-19 lockdown this year, Paris bars and restaurants will have to endure another blow as the government has announced their partial closures due to the rise in infections in the capital's metropolitan area. Starting from Monday, bars and restaurants will be required to halt service at 10 p.m. and prefects have the power to require an earlier curfew. Spain's health minister says residents in Madrid have tough weeks ahead over the coronavirus surge and will have to act with determination in order to take control of the pandemic in the region. With coronavirus cases rising, England and Wales have launched a new COVID-19 contact tracing app after months of delays and amid criticism that the app does not work on some older mobile phones.
Remember that a decline in the cases doesn't mean the curve has been flattened. Continue to take responsibility. For more stories and more updates, visit our website, channelstv.com. You can see our top story there. Google updating its free mapping service this week. We understand it's going to be a color coding map, mapping out areas infected with COVID-19. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.